America's public enemy number one in the United States is drug abuse.
That was a famous press conference of former US President Richard Nixon in 1971, where he called drug abuse the public enemy number one of the US. This statement started a global campaign to eradicate the production and supply of illicit drugs. It was popularly called the War on Drugs. Numerous reports have since suggested that the US War on Drugs campaign had racist origins. The Nixon administration used it to target the African Americans and the Hispanic population. 5 decades have passed since the War on Drugs campaign, and the truth is that this campaign has miserably failed. We still live in a world that does not see drug abuse as a public health issue but merely as a criminal offense, and the result of this approach has been devastating. Let's unbreak this news. On Sunday, when the International Day Against Drug Abuse and Illicit Trafficking was observed, there was a call from the United Nations to reverse the devastation brought about by the so-called war on drugs and promote drug-related policies that are rooted in human rights instead. Did you know that globally more women are serving prison sentences than men for drug-related offenses? Many of these women are victims. They needed medical care. They were non-violent, and some of them have been languishing in jails for first-time offenses. It is not uncommon to find many members of the LGBTQ community being housed in various prisons worldwide for drug-related offenses. Like, for instance, this transgender activist, Kenya Cuevas, who was imprisoned for 11 years without trial for the alleged possession of illicit drugs.
Durante 11 años vivir en un centro penitenciario donde me arrojaron en un lugar varonil, donde viví cierta serie de violencias, pero sí fue una experiencia fuerte.
Even to this day, in over 30 countries in the world, a wide range of drug-related offenses are punishable by death. Many countries, including India, still lack strong policies related to harm reduction and medical intervention and care for people who are addicted to drugs. Strong arm tactics and the threat of imprisonment are used in many nations as a coercive tool to incentivize people into drug treatment. Millions are held against their will in rehab centers. But the fact is that the governments worldwide have not been able to contain the drug abuse and trafficking issue through coercive measures. The truth is that this menace has only increased in the last 50 years, ever since the War on Drugs campaign was launched.
Instability from Ukraine to Afghanistan to Africa and beyond has increased the number of people in need of emergency assistance. The industry of illicit drugs continues to ramp up during these challenging times. In 2020, more than 280 million people around the world use drugs. Seizures of synthetic drugs have multiplied in the last 10 years, while the opioid crisis in North America claims more lives every day.
So if the War on Drugs campaign has not yielded results, what will? According to the president of the International Narcotics Control Board, Jagjit Pavadia, depenalization, decriminalization and legalization are alternative concepts to conviction and punishment, and this can form a human rights-based approach to drug policy.
The first global issue relates to the conceptual differences between legalization, decriminalization and depenalization. We highlight the need for a shared understanding of these concepts in line with the 3 drug control conventions. While the conventions do not contain definitions of these concepts, they do contain provisions that cover legal and policy frameworks to address drug-related behaviors. In short, decriminalization refers to the process where an offense is reclassified from criminal to non-criminal through legislative action. Depenalization, on the other hand, may include adopting mechanisms such as police diversion practices, conditional sentences, and widening prosecutorial discretion as alternatives to prosecution while the behavior remains a criminal offense. INCB emphasizes that proportionality should be the guiding principle in drug-related criminal justice matters.
These concepts of depenalization, decriminalization, and legalization may seem unacceptable to countries that have traditionally used force to deal with substance abuse. The idea behind these 3 concepts is not to allow the free flow of illicit drugs, but to use a human rights-based approach in dealing with the crisis. Like what was stated by the INCB president, proportionality should be seen as the guiding principle in drug-related criminal justice matters. The problem of illicit drug abuse and trafficking is so huge in the world that we live in today is that several countries have introduced unconventional methods to tackle this crisis. For instance, the Canadian government has decided to allow the province of British Columbia to decriminalize the possession of small quantities of drugs for 3 years, starting from January 31st, 2023.
As of January 31st, 2023, adults 18 and over in British Columbia will no longer be subject to criminal charges for the possession of up to 2.5 grams of certain illegal drugs for personal use, and the drugs will not be confiscated.
Mr. Speaker, our government recognizes that problematic substance use is a public health issue, and we are working with partners to advance a multifaceted health-based strategy to end the overdose and toxic drug supply crisis. That is why we've approved the BC proposal to decriminalize personal possession of small amounts of certain illegal drugs within the province. There is, of course, more to do, and we're taking action with a range of provinces and territories, as well as other partners, to end this ongoing tragedy. We know that we need to move forward on proper supports, and that's what we're doing with BC, and we look forward to talking with other provinces about that as well.
Many countries worldwide have started bringing in measures to see the problem of drug abuse as a public health and medical issue and not just a criminal matter. According to the World Drug Report 2022 that was released on Monday, the market for cocaine is booming with new record highs in the manufacture and high levels of use. The study has also found that women continue to be underrepresented in drug treatment. Even though almost 1 in 2 amphetamines users is a woman, less than 1 in 5 persons in treatment for amphetamines is a woman. The study also found that in 2020, an estimated 284 million people worldwide aged 15 to 64, the majority of whom were men, had used a drug within the last 12 months, which means 1 in every 18 people in that age group had used a drug. This is a 26% increase from 2010. According to the World Drug Report 2022, cannabis continued to be the world's most used drug, and there has been a 23% increase overall in the number of cannabis users in 2020 compared to 2010. According to the report, India is one of the world's single largest opiate markets in terms of users. The report notes that India would likely be vulnerable to increased supply, as there are already signs that an intensification in trafficking in opiates originating in Afghanistan may be taking place eastwards, in addition to southwards and westwards along the Balkan route. Even when it comes to countries reporting the largest quantities of seizures related to opium, morphine or heroin, this is where India stands. As far as India is concerned, drug possession or consumption is a criminal offence and is legislated under the Narcotics, Drugs and Psychotropic Substances Act, which is the NDPS Act. In India, there is still no relief for first-time users. The Indian law makes no distinction between addicts, recreational users and first-time users. Last year, the Ministry of Social Justice and Empowerment stated that drug users need rehabilitation and not jail, as the drug problem is a real problem that needs real solutions. The biggest problem with our current approach to drug abuse and trafficking is that the criminals profit from illicit drug trade, while the actual end users who fall victim to it undergo years of suffering, jail, and sometimes even face death. The solution to this is a radical shift of mindset, from seeing drug abuse as a major public health concern and a medical concern, than a criminal one. Drug users must be treated as victims who need rehabilitation and treatment, and not as those who have to be punished, discriminated against, or stigmatized. The war on drugs using the old, tried and tested formula must be ended. And to end drug abuse, countries must shift their focus to a new science-based, evidence-based and rights-based approach. As they say, addiction is a family disease. One person may get addicted, but the whole family suffers. Similarly, when it comes to drug abuse, which is a global problem, wrong policies affect not just one or some nations. It affects the whole world.